Hello, today we will discuss with you chronic skin disorder, psoriasis. Please looking at the plan of our lecture. First of all, we should discuss with you definition of psoriasis, then epidemiology or spreading of the diseases in different countries, nationalities, ages and gender. Etiology and pathogenesis will be our next step. Then pathogistological picture or changes which we will see at the patient with psoriasis when we will take biopsy from them. The next step, it is clinical manifestation or clinical signs of this disease. Next, diagnosis, and the last, I will give you the short information about treatment patient with psoriasis. First of all, we should give the definition of this chronic disorder. Looking for the first slide. Psoriasis is a chronic inflammatory disorder characterized by the formation of well-defined raised erythematous plaques with silvery white scales that preferentially localized on the extensor surface. As you can see at the picture which I prepare for you, this is a man, and at the elbow region, yes, elbow it's our extensors, you will see big, it means that more than 2 centimeters, elevated plaques. At the secondary lesion in this situation will be white calorish scales. Epidemiology of psoriasis. According to the foreign studies, the prevalence of psoriasis in the world ranged from 0.6 to 5%. As part of a review of epidemiological studies of psoriasis at the University of Melbourne, it was found that the incidence of psoriasis, according to the cohort study, averaged 60 per 100 population. So, as you can see on this slide, psoriasis is non-contagious disease. It means that you can't take this disorder by the simple hand snake, or for example by the kisses or by the tools which use ill person. It means that etiology of this disease another. So if we will take the both gender, men and women, yes, it will be equal. It means that in each situation it will be individually. This disease can touch men, this disease can touch women's. So if we will say about the age when psoriasis first of all touch the person, it will divide for two big groups. First group, it will be persons less than 40 years old. Mostly it will be adults start from the 50 until 30 years old, and the second group, it will be person more than 40 years old. Mostly we will see this skin disorder at the patient start from the 55-60 years old. About etiology and pathogenesis of this disease. So, the cause of psoriasis isn't fully understood, but it's thought that to be related to an immune system problem with T cells and other white blood cells called neutrophils in your body. T cells normally travel through the body to defend against foreign substances such as viruses or bacteria. But if you have psoriasis, the T cells attack healthy skin cells by mistake, as if to heal a wound or to fight an infection. Overactive T cells also trigger increased production of healthy skin cells, more T cells and other white blood cells, especially neutrophils. These travel into the skin, causing redness and sometimes pus in the pustular psoriasis. Dilated blood vessels in psoriasis affected areas create warmth and redness in the skin lesions. The process becomes an ongoing cycle in which new skin cells move to the outermost layers of skin too quickly, in days rather than weeks. Skin cells build up these thick, scaly patches on the skin surface, continuing until treatment stops this cycle. Just what causes T cells to malfunction in people with psoriasis isn't entirely clear. Researchers believe that both genetics and environmental factors play a key role at the starting of psoriasis.